With regards to the nose, it's a filter. It works to filter out big particles. Sometimes those big particles make it past the nose hairs, and then they get stuck on the lining. And if you look in the nose, it has shelves. There are 3 shelves in the nose that increase surface area, but it increases the chances that particles that are being absorbed will hit one of those shelves and get stuck. The problem when the nose isn't working properly is that it also swells up. When you have enough exposure to junk, to toxins, to smoke, to diesel fuel, your nose will actually swell up in protection, and then nothing gets through. So there's a balance where you have to clean the junk out. And the reason I put the filter here is because even in a car, you have to clean your filter every 3,000 miles. People who don't clean the filter in their cars will know performance stinks after a while because you're not getting enough oxygen. Same thing with the nose that's too blocked up. My teenagers are notorious for not wanting to do neti pot. You guys know what a neti pot is? My teenagers, I tell them, neti pot, please, especially wintertime, especially some of the old schools, the private schools, the basement classes are really full of dust and mold, but they kind of giggle and say, I'm not going to put anything up there. And I ask them, well, how do you get rid of all the stuff you just inhaled? And they say they blow their nose. And then I tell them, if you were to step on dog poop, would you just wipe it with a tissue, or would you try to clean it up with soap and water? Because you get more stuff away. And then they kind of figure out, if you have a snot that's dry, you're not going to be able, the best nose blower will not get that junk out from the entire day. So you have to wet things first, and that's what a neti pot does. It wets things, it lubricates, and it helps get things out. Panchakarma is a technique in Ayurveda that uses, believe it or not, techniques of vomiting, of purging and diarrhea, neti potting, breathing to get toxins out of the body. And it sounds nasty, but it works. Again, Ayurveda is such a great tradition, you just have to find the right person to practice it. So the special medicine to the nose is that it does connect the sinuses. And you can't really see it here, but there's the nasal passage, and then coming off the nasal passage you have this cavity of air, this cavity of air, 2 behind it. They're empty cavities because if they were solid mass, then your head would be too heavy. So you have to have hollow bone. And these hollow areas, they're like this room. They only drain out one way. So if the nose is all blocked up, then those sinuses will not drain out. And you'll have throbbing and pounding and just bacteria that are rebuilding and developing bigger and bigger colonies. So again, the nose has to be cleaned for the sinuses to drain out. Same thing with the back of the ear. You have this thing called eustachian tube. The back of the ear, if it's not allowed to decompress and depressurize through a stuffy nose, you'll hear crackling. You'll have people that say they feel like they can't complete the depressurization from coming off of a plane. Their ears are too full. They don't hear properly. That's usually because the nose is screwed up. So what do we do with the nose? Neti pot, simply saline is a nice answer, or steam caving. That's the old-fashioned way. You boil water, put eucalyptus oil in the water if it doesn't burn too much. Then you take a towel and you put your head over and you do some deep breathing. It works to give a large amount of volume of moisturized air into the lung, into the nose. Not only do you have the administration of the oil, you also have all the loosening of this stuff, the snot, all the loosening of the phlegm. And I have to tell you that my average person that's in sales usually does not want to drink enough water because it takes them either away from the car or away from the telephone. And when you don't drink enough water, even my truck drivers, they will say, I'll be a little dehydrated, I'll have 1 cup of water, but I can drink later. That's not the way it works. The body, when it's slightly dehydrated, doesn't work. It turns phlegm into dry patches. So you have bacteria that are supposed to be engulfed by big white blood cells, but the white blood cells are dehydrated tiny guys and they can't do their job properly. So doing the neti pot or doing the steam cave will get fluid to the white blood cells and the mucus that want to leave. So it works better to clear bacteria out. And again, it's nice, it's kind of applying water on the outside, but it works great. It makes you feel good and it allows you to take in water. I also tell my patients, especially the truck drivers, try to get enough fluid in so you're about urinating every 2 hours during the day. I think looking at your pee and seeing that it's the same color as the water is good enough, as long as there's no heart disease, obviously. But if you're peeing every 2 hours, then you know you're hydrated enough. If you're hydrated enough, then that intravascular space, that highway that gets blood cells from the liver or the spleen to the areas of attack, bronchus and the sinus, the highway will be full and open. If you don't have enough fluid, then your vascular space is collapsed. So think of it as an army trying to get to a fight on a one-lane highway versus a 6-lane highway. So more fluid, 6 lanes. Dehydrated, 1 lane. It gets white blood cells to where they have to get to faster.
Why not with heart disease?
If I tell a patient with heart disease or kidney disease to drink a lot of water, you'll overload the heart. So it'll cause them to either go through congestive heart failure, or they won't be able to, because of the kidney, won't be able to get rid of all the water, and then it'll build up. So you have to be careful with that. So if you guys push this to an older person or a friend, just the caveat is be careful with the heart. Decongestants, mucolytics, they do work. There's some studies that have shown that Mucinex D or guaifenesin doesn't really do anything in the long run. Even dextromethorphan in kids, supposedly it doesn't really change the total time of sickness. But you know what? If it helps to make things get better faster, if it compresses your time frame of healing, even if you still are sick for 10 days, if you're only suffering for 3, hey, I think you will do better, and you'll spread it less. Eucalyptus oil, I love eucalyptus oil. I think eucalyptus oil should be used in the shower. When you steam bath or turn on the bath and steam up the shower and hang in there instead of a steam cave, you just hang in the bathroom and you breathe in steam. I always say drop a couple drops of eucalyptus oil in the bathtub and let that pervade through the bathroom, and then you're in a steam room. There's also other oils to use, but the bottom line is to get the oil to where it has to get to. The nose, the lungs. Even if you apply oil to the meridian points of the lung. In Chinese medicine, there's meridians, there's lines of energy. And there's one called the lung line, and usually the biggest point is right here. So if you apply eucalyptus oil here, and then on the chest to somebody who's going through bronchitis, the practicality is they can at least smell the eucalyptus all day long. But the other practicality, if you talk to a traditional Chinese medicine doc, is that you're stimulating the lung meridian to move.
Can you use the eucalyptus oil directly, or do you have to just rub it on?
Yes.
Directly?
You have to be careful. Some eucalyptus is very potent. You probably will.
The one that I just passed around, which is RC, which I remember that you're familiar with, is it's very gentle. It can be applied directly onto the sinuses, and you'll feel like it pops the sinus right open. So you can put it above the sinus, you can put it here, you can put it right on your throat if you're feeling like you're getting. This is a blend of various, I think there's 3 or 4 different eucalyptuses in here, and RC for me is a standby during this time of the year. If I use it versus thieves, if I feel like I'm getting a cold or something's coming on, it's RC right away.
Just rub it in.
You can use it also, it stands for respiratory congestion, RC.
But you would put it all over your body. And
You put it on your chest. You can put it under the armpits, again, if you have, bronchitis. It can be used on the throat if you're feeling like you're getting a sore throat, back of the neck, the ears, all the way around the ears if you're feeling any type of congestion, sinus.
As far as you're talking about massaging with the oils, would you massage with that or not?
I wouldn't on the arms.
Well, good question with regards to using oils. Definitely use oils in traditional or vehicle where it gets to lung and lining of nose. Definitely. Respiratory system, if you can get it dispersed into that area via steam, fantastic. Or nebulizer, fantastic. I think there's also benefit to applying it to the skin. Not only in the moisturizing of the skin that's dry, but also because of those things called, again, we're getting into energy. Energy medicine in traditional Chinese medicine talks about meridians. I do acupuncture, medical acupuncture, and there's no question that if you put 2 needles in the lung meridian, it will usually improve the speed of healing of the lung. If you press the lung meridian, it will, not as fast as needles, but it will stimulate the healing of the lung. That's shiatsu, tui na. If you just apply oil drops or droplet technique, it too will work, not as deep as acupuncture, but it will work. It's better than nothing. And on a practical level, if you apply it to areas where you can smell it all day, then you have the power of the plant in you all day long. If you also think about it in those energy terms, then you have twofold positives. And there are different forms of eucalyptus. Well, one caveat is sometimes the purest eucalyptus oil is irritating to mucous membrane. So you have to be careful, especially if you get into the steam cave and you drop a couple drops of very concentrated eucalyptus. It can irritate, but I haven't seen that with any of the Young Living products. And I think they're very smooth. Sometimes if you go with other companies, cheaper companies, you might have different quality.
What's the name of the company?
Young Living.
Young
Young Living. There's also other aromatherapists who actually make their own oils. They'll actually take and distill plant, combine it with some organic oil, a base oil, and then make their own oils. And they'll blend. There's a science to actually aromatherapy. Depending on the response you get when you smell certain oils, the aromatherapist will actually blend and put together a combination that will heal you. Kind of like the Ayurveda and the dosha, you have certain foods, activities, behaviors, poses that work for your dosha. The aromatherapist will make it for the person. Really fantastic stuff. But yes, good question on the application. Not only do you inhale it, you'll also applying it will help.
And where did you say to, I was looking away, where did you say you said to apply it where it's?
Using the lung meridians in Chinese medicine, it'll start in the wrist and go the front of the bicep right across this point in front of the armpit, and then it ends here. That's the typical lung meridian. If you actually go online and you put down lung meridian, without opening up the big topic on the meridians, you'll actually see where the points are. And if you were trying to just figure out where to apply the oils, you just look at the picture online and kind of follow as best as you can. And it's going to be you're going to be kind of like a buffalo applying the oil instead of like a special forces person trying to apply the oil right to the meridian, but that'll give you a ballpark of where to apply it. I like this area right here. I think it's lung 2. Very sensitive, usually stimulates very fast, and you can't go wrong. You just apply it to the front. And plus you can, again, get the wafting aromatherapy from it. This thing called Kella is a plant. It comes from a root, and it's found to help with inflammation. It's also found to prevent and reverse sinus problems. It decreases swelling in the nose. And actually some pharmacy actually figured it out and they labeled it as nasal crum. You can get this over the counter. It's a great nasal spray. It used to be a prescription back in the 90s that I would always prescribe when it first came out. It was great. It turns out they actually got it from a plant. So you see the pharmaceuticals are also doing the right things too. Now as far as how pure it is, I don't know. But if the last ditch ever, if you wanted to try, it's hard to get Kella on your own in a store. Pretty decent nasal crum. If you do it twice a day, 2 puffs each nostril, it decreases swelling. It tells those little cells in the nose to not swell too much. You have to have inflammation. But if you have an overstimulation of inflammation, it blocks things up. So if you can control the amount of inflammation, it'll again compress the time for your healing. And a nasal crum you can get over the counter. Everybody knows quercetin, and I think twice a day is pretty decent. There's some nice studies that show that it helps with rhinitis and sinusitis. Everybody knows quercetin as being an antioxidant, but again, if you have, as far as using quercetin with pregnancy, you have to be careful. Kella, it should be safe, but you'll see on the side of the bottle that Kella will not ask your doctor in case of pregnancy. Most of the spray-on and topicals should be considered safe. You can ask me later on if you ever have any problems, but quercetin, because you have to eat it, there's not enough studies that have said it's not a problem with pregnancy. You have to be careful with that one. Supposedly, since the studies have shown it decreased the amount of time of the rhinitis and sinus infection, we figured it helped. but they're still trying to figure out why exactly it decreased. That's Western medicine. We have to go down to the nuts and bolts of why things work. Once, really, if it's not going to kill you, and there haven't been any bad side effects with it, and it doesn't cost that much, will it really need to do we have to do all the studies to figure out if it helps or not? I don't think so.
Does it have another name? You said everybody knows it? I've never heard of it.
Well, you probably hear about it a lot on Oz, and if you look online for antioxidants, you'll see quercetin is being listed. You'll see a lot of the Vitamin Shop, the Fruitful Yield, Whole Foods will usually have it on the shelves this time of year. So I'll list with the 5 different body parts, my favorites, as we go down the line. And this will be all online if you ever want to access this later too. Just send your, or maybe just give me your emails and I'll send you a link. Athlon nasal spray. Now that's a prescription nasal spray, so it's an antihistamine. But if anybody is on Claritin or Zyrtec, they work great, especially the worst times of year. Most people are allergic with the change, so September, October was tough, and then May, June will be tough. So if you have sickness on top of those times of years, then I don't say stop the Zyrtec or Claritin. But if you haven't heard about Athlon, I think it's an easier application. Instead of popping a pill in, you actually spray on and get the benefits of a nasal spray and your antihistamine together. So you have an easier application and less side effects, again, less drowsiness than taking Zyrtec or Claritin D. These are great. You have to be careful about blood pressure though, and drowsiness as well. That you have to ask your doc for. And plus. I think it's very important not to cause further damage, and anyone who's blowing their nose 3 to 4 times a day with regular tissue will eventually get that red nose, the irritation, the abrasions, and that leads to infections inside the lining of the nose. It's very painful at that point to blow your nose because of the pimples that develop on the inside. So plus, although it throws a lot of dust into the air, it's a moisturizer. Unless you just take plain old Kleenex or like some of my high school kids, the big paper towels, and just tear everything off the nose and chase that with moisturizer. It's totally up to you, but I think it makes a difference, causing no further damage. So that was nose. This will be lung. Lungs' basic anatomy is that of having tiny hairs that all beat in one direction. It's really cool. If you look on a microscope at the lung tree, the pipe, it has these tiny little cilia that always beat up and out, one direction only. And they're frozen when you smoke. They don't work when you smoke, they just are paralyzed. So stopping the tobacco is important for getting the cilia to start beating up again, because we're mostly standing all day long. If you have bacteria that are engulfed down here and pus that's formed down in the deepest ports of the lung, unless you turn upside down or do yoga or hock up, that's why I put hockers. Unless you hock up with the diaphragm and get the big goober going up, it won't come out. And then you'll be stuck down here, and the more phlegm balls that you have down here, that's a mixture of white blood cells and dead bacteria and live bacteria, the more you have down here, the less oxygen you take in. The less oxygen fighting capacity for the white blood cells. So it all makes a difference. So those tiny hairs always beat upward. The walls secrete, but sometimes they secrete too much. And again, the diaphragm, if it's working properly, will launch everything out. But unfortunately, it doesn't always happen. So how do we improve it? Again, steam caves. Steam up the bathroom. Use essential oil if you can, eucalyptus. Liquefying, and if there's mucus that's dry, you want to keep up with the fluids. Those two we mentioned before. Mucolytics, as far as the eucalyptus, tinctures are important too. You can always get, if you don't like the pills, you can get tinctures that are blended at Whole Foods and or Fruitful Yield. Whole Foods is, I like Whole Foods, a little pricey. Fruitful Yield is sometimes cheaper. Do we have an herbal shop around town?
There is, I'm trying to think of the name of it, Sweetgrass.
Sweetgrass, okay. They probably will have tinctures as well. Is that, where's that in?
Sweetgrass is on Golf and Bussing.
I will have to visit. Most of the herbal shops will have tinctures. Tinctures are kind of a concentrated way, just like distilling a plant and getting the oil in essential oil. Tinctures are a concentrated way to get the active ingredient of a plant but carry it in a vehicle like alcohol or glycerin. And if you, it's double concentrated and it's absorbed faster versus putting that into a pill. So an option instead of pills or capsules is tinctures, but you have to get to a good place that makes the proper tincture. So if you can find eucalyptus in a tincture, even faster. And also lozenges always help. The only problem with lozenges is most of the lozenges have a lot of sugar and binders, so you have to be careful about what else you're getting with your lozenge. Oh, and the other good thing about mucolytics, tinctures, and lozenges, you can give them to kids, so very safe. Again, Kela, there is an inhaler. Kela, as we talked about before with regards to nasal sprays, can also be given via inhaler. And there is a prescription inhaler because another company found out that it was very helpful called Intal, and kids can use Intal inhaler. So administering the Kela through the lungs is also another way to improve and compress the time frame of healing. That, though, you need a prescription for. Bronchodilator, if you're an asthmatic and you need, and the doctor hears wheezing, sometimes if it's that bad, if the infection's that bad, whether it's a virus or bacteria, you need to open the lungs. Remember I mentioned that the lungs are a tube and the tube can constrict. Sometimes it makes it hard to breathe, less oxygen, so in the worst case you might need a nebulizer. That's the prescription medicine for opening up what usually is experienced in asthma. And then there's butterbur and licorice tea. I think butterbur is a great anti-inflammatory. I usually use it for people who have sinus headaches. The studies have shown very little side effects with butterbur, except for one thing. You have to have something called, it has to be PA free. Most of the companies will usually put it on their label, PA free. I would check. There's a really good company that is in Bolingbrook, near Stratford Square Mall, Now Food Products, and Bloomingdale, right? And they have telephone access to their nutrition department. There's 4 people in a nutrition department, and I've queried them a couple times asking about their specific. I asked them if their butterbur is PA free, and they said, yeah, it's on the label. I just wanted to test them. Actually, I just wanted to see if they would answer, and it's nice. Then I said, would you mind if I asked you more questions? And they actually said, if any of my patients have questions, they can actually just call, even if you're not going to buy their product, which is really nice. If you're at a vitamin shop and you're not sure which one to pick, what kind of magnesium to take, you call their 800 number and you should be able to get through. And you speak to one of the representatives in the nutrition department, and they'll tell you, this is what we studied, this is how it goes, take this instead of this. It's really nice. Now Foods in Bloomingdale. Now Foods in Bloomingdale. They actually give tours of their factory too, once a month.
Fruitful Yield carries a ton of
Yeah.
their product.
Usually found at Fruitful Yield.
Yeah.
Great company, up and coming, national now, and they are local, so it's excellent. You're supporting local people. Very good quality stuff too. Licorice tea also. I think licorice is great. I tell my folks with upset stomachs to use licorice as mucilage. It liquefies. If you chew it up and mix it with saliva in your stomach, it protects the stomach lining because it coats. As far as licorice tea, it'll help the lining of the lung to produce the protective lining it needs to protect from further drying. Licorice tree and butterbur, both are great things if you can find them in your local herb shop. If you can't find it, then you can actually get tea bags in the grocery store that usually have licorice. It'll usually be for upset stomach, but you can use it for upper respiratory tract infections as well. Just have to be a little bit careful with the amount of caffeine in your licorice bags. Pulmonary therapy, I don't know that anybody does this anymore, but if you've ever had a problem with a kid that had recurrent infections when they were younger, usually if you kind of tap the back, you'll actually help phlegm loosen. I know when I was in school in the late 80s and the 90s that we used to always suggest pulmonary therapy for our people with chronic obstructive lung disease, COPD or asthma. I don't know that insurance covers it, so we don't really use it that much, but it really helps get phlegm going. So these guys at the hospital, Northwest Community Hospital, are fantastic, but nobody usually uses respiratory therapists anymore. If you want to just do it at home, you just have to get right between the chest, as long as there's no fractures or osteoporosis, between the shoulder blades, cup your hand like this, And usually you get to a, it's very obvious. It actually feels pretty good. If you clap the back, it actually feels pretty decent, and you'll see that some kids will actually launch phlegm up after that. 15 minutes in the steam up bathroom. If you get phlegm out, I know it sounds gross, but if you can get the phlegm out that would have caused them to cough all night, you have a better night. Because most of the phlegm, when you're standing up, is stuck. When you lie down, all those little cilia bring the phlegm up, and then you wind up coughing or expectorating every half hour at night, and then you just blew the night. When you can get all that stuff out before you sleep, you have a better night, you have better healing, you have better fighting the next day with your white blood cells. So I think chest pulmonary therapy is great. I put down scraping and TCM. There's a technique where there's a whole bunch of meridians that travel across the back. I've seen Vietnamese people do this. They take a big coin and they'll scrape the skin of the back. They won't really scrape and break skin. They'll just scrape it like this, like taking a coin, and they'll cause a little bit of almost like an Indian burn, like a reddish discoloration to the back. But in a sense, you're scraping the skin. It's called gua sha in traditional Chinese medicine, and you're stimulating every meridian that goes through the back. And there's a lot of, it also feels good to the lung, but that's another way you can get the phlegm going in energy healing terms. And then maintaining sleep is very important. If you can't sleep, then sometimes I'll use the medicines like Tessalon or codeine to kind of knock the urge to cough down. But with side effects of codeine, of narcotics, constipation, drowsiness, Tessalon's a nice way. It actually is a numbing agent. I forgot the ingredient, but it's a numbing agent that you swallow, comes up after you burp a couple times, and it numbs up the throat so you don't have to cough as much also. So it's nice for teenagers if you don't want to give them codeine. Obviously, those are all prescription. Special mention has to be made to vitamin D3. I think the studies with D3 have been fantastic with asthmatics that were steroid resistant, so asthmatics that were having an asthma attack, but the steroids weren't working. It showed that if you had D3 levels into the 30s, which is really low, but if you had D3 levels into the 30s in your blood tests, they fared better than people who had low D3 levels or vitamin D levels. So all my patients know that I like to have their vitamin D levels at about 50 to 70. So D3 should be a standard. If my patients are taking it before the infection, definitely want to increase the dose during the infection. And again, the studies have not shown that many side effects to taking high burst D3 supplements either. There has to always be weighed. If I make suggestions for butterbur or licorice or D, you have to weigh the decision to suggest it during the infection, whether you're on antibiotics or not, and the literature that says there's side effects to it. If there's no side effects to it and it's not too expensive, I say try to get a couple other things going so if I give you an antibiotic, then it works better. If I don't give you an antibiotic, then you heal better. Magnesium definitely improves lung volume in chronic obstructive lung disease or sufferers of COPD. The only problem with magnesium is, as far as side effects, it can cause diarrhea, and sometimes it can also be accumulated very quickly in people who have kidney disease. So you got to be careful. If there's any kidney disease, no extra magnesium. But if there's no kidney disease, definitely magnesium. The doses for my standard patients is about 400 milligrams twice a day of magnesium glycinate or magnesium aspartate. It gets absorbed a lot easier. And asthmatics definitely helps. Diabetics, magnesium is fantastic for making diabetes quiet down a lot faster. Vitamin C actually does help. It has helped in studies showing that it increases something called FEV1, forced expiratory volume, within a second in an asthmatic. The only problem is there's questions to the dosing of vitamin C. I think a lot of people, when they go to vitamin shops, will hear about mega dosing. We know it helps, and there's limited data, but it's there. The question is how much. I would go with what's usually suggested with the IOM, but that'll have to leave with limited guidance. But the three things are vitamin D3, magnesium, and vitamin C that have helped fantastic with improving or truncating the amount of time suffering.
And how much magnesium did you say?
Magnesium is usually about 400 twice a day. Vitamin C, again, it kind of depends. If there's no kidney stones, I would use 500 a day, but it, again, depends on the patient. Because I guess that's the side effect, or downside of vitamin C, high dosing. It's been thought that it stimulates kidney stone formation. So you get through your infection, but then you get kidney stone. The studies are kind of plus minus whether it really does that or not.
Is magnesium known to upset your stomach?
It can, depending on the type. Magnesium,
There's a powder, it was a powder that I took, and it's called Calm. It was magnesium with calcium,
mhm.
and you take 1 teaspoon, but then you gradually build it to 1.5. I got to 1.5, it's just killing my stomach. I couldn't stand it.
As far as diarrhea or upset stomach cramping.
Upset stomach, yeah.
It could be,
Heartburn, acid reflux. That's
huh,
what it
interesting.
was. I thought it was supposed to help that, but it seemed like it was causing that, so I just stopped.
Well, magnesium in its basic form, in a nutshell, magnesium is supposed to help with calming. In traditional Chinese medicine, magnesium, if you use it, calms down anxiety. It takes care of palpitations. It stops cramping muscles. It settles and moves constipation. So the only problem is the scientific administration of it. When you combine it with calcium, sometimes calcium will not be necessary in some patients, and if you throw calcium in on a stomach that's got an ulcer, it might make things worse. So it kind of depends. I would always say if that's the only symptom, maybe try a different formulation. And there's 3 different types. There's oxide, which is sometimes irritating to the stomach. There's aspartate and glycinate, which are a lot easier on the stomach. So it depends on what and how yours is blended or created. It also depends on if you really need the calcium as well. Most of us with hypertension will benefit from magnesium, calcium, and potassium all together. And most of the supplements out there are magnesium, calcium together, kind of a good go-to. But sometimes if you have problems with that one brand of applying it, then I just say try magnesium. If it's not too expensive, try magnesium by itself. And go with the more pricey stuff, glycinate or aspartate. Just make sure your kidneys are okay. And with regards to special mention, if we cannot get through and it's the symptoms of the lung and the coughing and the chest tightness are way too tough to break, then I go for steroid burst. And that's when I pull the prescriptions up because, again, if it's that bad, then I use Western medicine to truncate in the time period of suffering. And an asthmatic, a well-documented asthmatic that is suffering past a certain amount of time, it will really get to the point where you have to go to the hospital and be admitted. So that's where I say time for the burst. So steroids are useful. Steroids calm down a lot of things. If I give my athletes steroids for an asthma, their joint pain will go down, their neck pain will go away, their nose will open up. They're great. However, they also cause a whole bunch of side effects. They'll cause anxiety, they'll cause insomnia, they'll cause diabetes to skyrocket high. And also, it'll make the body stop making its own steroids. So you have to be careful. For a burst of 5 days, even for a child at the proper dose, I'd say if it's that bad, then do it under my guidance, and then usually in the morning only. I don't like the Medrol dose pack. I think all the studies over the last 2 decades have said you don't have to taper it down. And those things called Medrol dose packs, they come in tin foils, you press them out for 6 days straight. They taper them down, but you don't have to taper down, so by the 3rd or 4th day, you're on minuscule doses, and why even bother taking it? I think 5-day burst at the same dose every morning will decrease the problems at night with insomnia, and it'll give you what you need to get through. And I usually tell my patients, if you're feeling better by the 3rd day, stop the rest of the steroid. The other problem with steroid is that, well, again, you stop your own steroid, but if you stay on anything for longer than 5 days, it has to be tapered off by your doc, and it gets to be messy. So if we need it, 3 to 5 day burst, and that's it. And then have to mention the vaccine. The vaccines, I do have to say that the influenza vaccine in studies has shown to decrease the amount of times that an asthmatic person would go to the hospital. Having said that, everybody that I talk, the majority of people that I talk to that come into my office, when they get the vaccine, I don't carry it in my office, they always talk to me about side effects of the vaccine. Body aches, fevers, chills, coughing are the actual symptoms of influenza. And it is a toned down protein from the actual influenza that's regenerated in a lab that you're getting when you get the influenza